5,722. That is the number of lives lost to the fentanyl crisis in California just last year. You can see it here, nearly 6,000 people killed by this drug. Of course, their families, friends, and communities are shaken by this growing epidemic.
Yeah, fentanyl is similar to morphine, but about 100 times more potent. We've seen it hidden in pills, with people not knowing that they're taking the deadly opioid. Nearly every county in California saw at least one person die from fentanyl last year. There are 4 counties in the greater Sacramento region that have had some of the highest death rates. We're talking Butte, Nevada, Sutter, and Yuba County.
I've lived here my entire life. I was born and raised here, so yeah, I've seen a lot of families that have been impacted by drugs, specifically by opioids and fentanyl, and it's heartbreaking.
It's scary. Each county, though, is taking a different approach to address the fentanyl crisis in their community. Yeah,
today, KCRA 3's Michelle Bandor went to Yuba County to see how they are tackling the epidemic.
Emergency room nurses and doctors in the only hospital in Yuba County are watching people overdose and die from fentanyl in record numbers.
Have I seen people with the overdose in fentanyl? Yeah, well, that's a given.
Casey in Sing May is the emergency department manager at Adventist Health Rideout Hospital.
It's not a scary sight of you frantic or going psychotic, losing your mind. It's actually the opposite of where you're getting so sleepy. And it could be kids, it could be teenagers, it could be young adults, it could be old adults just sleeping and then not waking up and not breathing anymore.
Fentanyl is meant for supervised patients with severe injuries like gunshot wounds or car accidents, and very little is needed. That's why county leaders say the synthetic drug made on the streets is so deadly.
They think that they're taking some hydrocodone, and really they're taking a lethal amount of fentanyl. That's why it's so dangerous.
The Yuba County District Attorney offers treatment and the direct phone number of a counselor to drug users who come into the judicial system.
We're absolutely still using every tool that we have left in our toolkit. It's just gotten a lot harder.
Yuba County healthcare workers are going to events armed with Narcan, giving it away for free. In fact, this hospital has handed out 7,200 kits, making it the top 2 hospital in the state for giving away the life-saving measure.
If we could get education and awareness out that Narcan can save someone's life, the next step is, okay, we got to make Narcan accessible or readily available for everyone.
One way Yuba County leaders say they can lower the number of deaths in their community. In Marysville, Michelle Bandor, KCRA 3 News.
And as county leaders study the data, they believe that those who are dying are a mix of habitual drug users looking for that potent high, as well as young people who don't know that they're taking fentanyl. Well, Yuba County, not the only county in our area feeling the impact by this growing epidemic.
Yeah, Ty Steele joins us now. So, Ty, we've seen a dramatic increase in these deaths.
Yeah, in the last few years especially. And as you guys mentioned, 5,722 people died last year at the hands of fentanyl. That was a dramatic increase from years past. In 2013, for perspective, only 88 deaths were reported to the Department of Public Health. Every 2 years since then, that number has increased. In many years, it actually doubles. 2019, there were 1,600 deaths due to fentanyl. Last year, 5,700 deaths. Our digital team looked into the deaths per county, and you can see this interactive map here by scanning the QR code at the bottom of your screen. Let's look at the death rate in some of those counties to give you even more perspective. As we mentioned earlier, Butte, Nevada, Sutter, and Yuba counties have the highest death rates in the greater Sacramento region. Butte, Nevada, and Sutter at 20 deaths per 100,000 residents. Yuba was slightly under at 16 deaths per 100,000 people. Stanislaus County was at 14 deaths per 100,000 people. They had 79 deaths last year. San Joaquin County had more than 100 deaths last year, which is 13 deaths per 100,000. And Sacramento County had 7 deaths per 100,000 people, which makes up to about 120 people. San Francisco County saw more than 380 people die last year, and in Los Angeles, more than 1,000 people died. We will, of course, continue to reach out to these counties to see the actions they're taking to fight this growing epidemic of fentanyl. But again, every year it seems to be getting worse.
It's unbelievable, Ty.
Truly.
Yeah. Thank you so much. All right.